And it's my privilege to introduce Larry Schonberger from the CDC, who's played such an important role in the work against Reye syndrome. And Karen Starko really told quite a bit about what the leadership that Larry's provided in that. And so it's a pleasure to turn the microphone over to Larry Schonberger.
Well, good afternoon. As was said, I'm Dr. Lawrence Schonberger, and I'm here and happy to thank the meeting organizers for the invitation to join you at this 35th annual meeting of the National Reye Syndrome Foundation. I'm particularly honored to participate in your special ceremony commemorating the history of the extensive collaborative efforts by the many people in this room, and as well as the many others who worked and who continue to work to prevent Reye syndrome. I'm a medical epidemiologist who joined what is now the Centers for Disease Control and Prevention, CDC, in Atlanta, Georgia, 38 years ago, as an Epidemic Intelligence Service EIS officer, class of 1971. As Karen mentioned, the EIS is a 2-year CDC training apprenticeship program in epidemiology. Most trainees graduate from the program and take on medical jobs in academia, in industry, or in other parts of the private medical sector. Many assume jobs in other government agencies, and some, like me, continue their career at CDC in epidemiology and public health. For my 2-year EIS training, I was assigned to an epidemiology unit that was responsible for poliomyelitis surveillance and other virus-related neurological illnesses, including the mysterious Reye syndrome. An earlier member of this same unit, who you know as your Scientific Advisory Board Chairman, Dr. Thomas Glick, class of 1969, had established in selected states, including here in Ohio, with several other EIS officers, a 30-month-long surveillance system for Reye syndrome that, among other things, showed increases in the incidence of Reye syndrome during outbreaks of influenza B. In 1976, I became the supervisor of this unit, and in that position, I arranged for the EIS officers I recruited each year to investigate Reye syndrome and to continue long-term a primarily passive system of epidemiological surveillance of Reye syndrome throughout the country for at least the next 18 years. In 1999, the results of this surveillance were published by Dr. Ermias, EIS class of 1994, in the New England Journal of Medicine, and many of the previous speakers showed that particular slide. And the data in that slide illustrated that the number of reported cases of Reye syndrome declined sharply after the association of the syndrome with aspirin was widely publicized in late 1980. After a peak of 555 reported cases in children in 1980, there was no more than 36 cases per year reported since 1987. Although most people know and understand that our surveillance was far from complete, at one point I estimated that we were getting about 1/5 of the actual cases that were out there. There is a general consensus that the public health impact of Reye syndrome markedly declined after people were informed about the probable etiological role of aspirin for this terrible illness. Many people recognize that the prevention of Reye syndrome has represented a major success of epidemiology and public health. Every year throughout the world, thousands of cases of this horrible illness do not occur because of the work of many people, including many of the people in this room. As it should be, the National Reye Syndrome Foundation, among several of its accomplishments, must be very proud of its successes as well as its continuing efforts to educate the public about the increased risk of Reye syndrome associated with the use of salicylates in children. This ongoing educational effort of the Foundation is indeed extremely important. Ms. Drake wanted me to relate some of my own feelings about the Reye syndrome story rather than to present a typical scientific presentation. One feeling I have is pride about epidemiology and public health because of their critical role in the largely successful story. As epidemiologist Roger Dietels stated in a speech of his last year at the American College of Epidemiology Abraham Lilienfeld Awards ceremony in Tucson, Arizona, quote, "Epidemiology is more than a science. It is an art. The art of knowing when and how to apply the various epidemiology strategies and methodologies creatively to answer relevant health questions," unquote. This art, among other things, includes asking the right questions, recognizing the correct interpretation of the data and their biologic and policy implications. My own experience with Reye syndrome, as I am sure many of you would understand, brought forth the tensions that exist between the central purpose of epidemiology and the translation challenge of having epidemiological results change public policy to improve health. Although the central purpose of epidemiology, according to Dr. James Marks' EIS class of 1976, is to, quote, "find, assess, and confirm truth," such scientific discovery and the widespread application of findings must never be separated. According to Dr. Marks, quote, "each bears little fruit without the other," unquote. Thus, another key role of epidemiologists is to frame issues in a compelling way to make the results persuasive and most likely to be acted on through policy formulation. Hence, it should be no surprise that among my efforts during the Reye syndrome saga, about which I am most proud, besides the establishing and maintaining of long-term Reye syndrome surveillance, is my helping to write reports and editorials in CDC's Morbidity and Mortality Weekly Report, the MMWR, between 1980 and 1982. They provided, if you go back and look at them, gradually stronger warnings against the use of salicylates to treat children with an influenza-like or varicella illness. The most widely publicized and, in retrospect, probably the most effective in preventing Reye syndrome was the MMWR editorial published in November 1980 that stated because of Reye syndrome, quote, "parents should be advised to use caution when administering salicylates to treat children with viral illnesses, particularly chickenpox and influenza-like illnesses," unquote. At that time, this very controversial CDC cautionary statement resulted from our own internal review at CDC of the results of the important case control studies that had been conducted in Arizona, Michigan, and Ohio. The results of each of these three first ever case control studies of aspirin use in Reye syndrome were initially published in the MMWR, and each showed that aspirin was associated with the development of Reye syndrome. In 1982, some key pharmaceutical industry representatives successfully derailed the efforts to have a Reye syndrome warning label placed on aspirin-containing medications, and convinced the American Academy of Pediatrics and the Assistant Secretary of Health that to proceed with any such action would require completion of at least one more study. At that time, Dr. Eugene Hurwitz in my small epidemiology group and me seemed to be regarded by some aspirin industry representatives as too biased to objectively conduct any additional federal study on the issue. After all, we've been issuing warnings in the MMWR. Nevertheless, a rather ingenious arrangement was worked out whereby my small epidemiology group could help execute the Public Health Service study of Reye syndrome and medications as part of an interagency task force. Meanwhile, the study protocol itself, the study's progress, and its analyses were to be done under the supervision of an advisory board of the Institute of Medicine that would in turn receive input from both the Public Health Service task force and from representatives of the pharmaceutical industry. In retrospect, I take pride in my participation in conducting this Public Health Service study. Its results enabled the U.S. Food and Drug Administration to finally mandate in 1986 the placement of Reye syndrome warning labels on aspirin and aspirin-containing medications sold in the United States. One very important epidemiologist who I believe deserves to be honored today, but who unfortunately died of Lou Gehrig's disease in 2002, is Edward A. Mortimer, Jr., MD. I have tremendous respect and admiration for his epidemiological judgment, his courage, and his integrity, and encourage everyone here who may not be familiar with any of his contributions to at least read his 1987 editorial published in the Journal of the American Medical Association. In this editorial, Dr. Mortimer describes the delay between the tentative Reye syndrome-related warnings about salicylates in 1980 in the MMWR and the definitive warning placed on aspirin-containing medications in 1986. He mentions the 1,003 cases of Reye syndrome, including 291 deaths that were reported to CDC during this delay. He knew, of course, that because of incomplete reporting, these minimum figures understated the higher number of actual cases. In his editorial, he is clear about the fact that some aspirin manufacturers used inherent weaknesses of retrospective epidemiologic studies to first apply direct and successful pressure on the Office of Management and Budget to delay public warnings or package labeling. Second, that these manufacturers sent misleading reassurance to physicians. And third, that they openly threatened a lawsuit if the American Academy of Pediatrics published a warning. Dr. Mortimer published the fact that he considered these actions to be, quote, irresponsible. They jeopardized the health of children unnecessarily and cast an unfavorable light upon the usually respectable pharmaceutical industry, unquote. Given Ms. Drake's request for me to share at least one personal tidbit of history, I will mention the not well-known relationship between the important Ohio Reye syndrome case control study and the earlier emergence of a new swine influenza virus in 1976 at Fort Dix, New Jersey. As a result of the emergence of that swine flu virus, CDC received increased funds to support influenza-related work, including a national influenza immunization program to vaccinate the U.S. population against the new virus. After I reported that the swine flu vaccine was playing a key role in triggering cases of a polio-like illness known as Guillain-Barré syndrome, and given the fact that the wild swine flu virus in people disappeared in February 1976 and did not reappear, the National Influenza Immunization Program was stopped in mid-December 1976. Subsequently, I was asked by one of my supervisors, Dr. Philip Brockman, if I saw a potentially good use for some CDC monies that had been allocated to study influenza-related issues. I indicated yes, and used the funds to help initiate a cooperative agreement with the Ohio State Department of Health to support what we now refer to as the Ohio Reye Syndrome Case Control Study. Understandably, the initial protocol for the Ohio study focused primarily on influenza viruses and possibly other viruses related to Reye syndrome. A call to me from Dr. Karen Starko, however, about her findings linking aspirin and Reye syndrome in Arizona got me to start looking into the possibility that this was an important issue. And as I recall, I asked Dr. Hurwitz to check what the data, at least that we had at that point, was looking like in terms of this association. And he came back and said, Larry, it looks like Karen Starko is onto something. And when he told me that, we quickly changed the focus of the Ohio study from one that was primarily focused on the viruses to one that was focused on the treatment of the antecedent illness. And the rest is history.